Good afternoon to everyone who has joined us on this phone call. Thank you for joining us for this Tele-Town Hall with Mayor Randall L. Woodfin. We will be taking your questions during this call. You can press 7 and ask a question. You'll be connected to a screener. The screener will take your information and we will plug that into our system so we can review the question and respond to you as soon as possible. In addition to that, we want to get your opinion and your thoughts on a variety of issues concerning COVID-19. We will be asking you questions during this call as well, and we will tell you how you can respond to us while we're on the line. With that now, I would like to turn to Mayor Randall L. Woodfin for opening comments.
Hey, good afternoon, everyone. To all the Department of Public Works employees, I'm grateful you all are on the phone. What we're going to attempt to do today is I have some few comments and probably some thoughts around some of the issues we've been dealing with. Then I have your leader here with me, Walt Givens, who can address some issues as well. I'm speaking with you all this afternoon because I know that many of you all are concerned. You're concerned about your families. You're concerned about the men and women that to your left and right you work with every day. And I know a lot of you all are concerned about the residents you serve. My first line of concern is with you all. And so let me and Walt tell you what we are doing for you at a high level. And then I believe we can answer some of your questions. Of course, many of you all know 2 days ago we put in place a shelter-in-place order. We believe this is for the benefits of our residents, but it's also for the benefit of you. We have to decrease the number of potential people you may come in contact with. Secondly, Walt is working to increase the amount of personal protective gear that's available for you. We have just placed a significant order for supplies. In addition to that, we know that there have been concerns about social distancing in your vehicles on your shifts. And so I'm going to have Walt explain a new protocol to ensure that you are not only are safe, but that you feel safer on your job as well. And at this time, I'm going to have Walt chime in, and then he'll turn it back over to me.
Yes, thank you, Mayor. Team DPW, this is Walt Givens. So I'm going to speak to some protocol here we're working through. This is something we're very heavily crew-driven on what we do on a day-to-day basis. We depend on each other, and with that, we're crew-dependent. With the social distancing requirements, what we are doing and we'll be implementing is two things. We have two typical types of vehicles with single cab and vehicles with crew cabs. The single cab trucks, in order to maximize and enforce the social distancing 6-foot distance, there'll be 2 individuals maximum for a single cab truck on either side of the vehicle. For vehicles with crew cabs, we will increase that number to 3, with 2 being in the front and a single employee being in the back middle to maximize the distance between your crewmates. So that's social distancing is the biggest issue and hurdle we have to get to ensure you as our number one asset is safe in doing and carrying out the duties of your job. That was the main thing we were looking at for this too.
So with what Walt has said, I want to remind a lot of people on this call there are exceptions based on the type of work people are doing. Some of that is humanly impossible. So another projected question we know is centered around I'm physically at work during this situation. And many of you all are questioning that other City of Birmingham employees are teleworking or otherwise not at work and getting paid. So the question you have is, will I get paid extra hazardous pay during this time? The answer is no, and I want to explain why. The Department of Public Works employees have been designated mission essential and perform critical services to keep the city operating. Most Department of Public Works employees have been designated as critical infrastructure personnel as defined by the U.S. Department of Homeland Security. That means the national government created this guide to help state as well as local cities and officials such as Birmingham protect their communities, but also striking a balance to ensure continuity of functions critical to public health and public safety. Department of Public Works, what you do falls under making sure public health and public safety continues, even under a health crisis, as well as national security at the federal and state level. And so you are being paid for your valuable service you provide to your city and its residents. Another question we have is, it says, I see other personnel in public works working different shifts or working at home. So the question is, why are the shifts not consistent in every work center? What we looked at is each individual work center and the service provided by each individual work center to determine the safest and most efficient way to provide our services while protecting our employees. Just because we're in a health crisis doesn't mean all of a sudden we look at all of our work centers the same. So no different than before this health crisis, we looked at our individual work centers differently. We continue, even under the job we're doing now, to look at our individual work centers differently. A third question, and then I'll turn it back over to Rick Journey, who will guide us through the remaining questions, is I work in horticulture and cut grass. I cut right-of-ways, I cut lots. I cut parks and or work on a herbicide team. How is this considered mission essential? The answer is pretty simple. Maintaining vegetation is vital for a few reasons. One, and these reasons are very key, we have to ensure motorist safety while traveling on the City of Birmingham thoroughfares. There is no position where we can just stop cutting that and let it grow in such a way that people don't have line of sight because they have to move from point A to B. The other reason is ensuring resident safety and sanitation of their homes by maintaining the 22,000+ vacant lots throughout the city and its neighborhoods. So again, this team that you all are a part of are still responsible for critical infrastructure for cities to be able to move. With that, I'll turn it back over to Rick Journey, who will facilitate the remaining of the questions.
Thank you, Mayor. A reminder once again, and we have several questions that are coming in, so we will be starting with those. If you have a question, you can press 7 on your dial pad. You will then be connected with a screener who will put your question into the system so we can see it and we can ask it. As I mentioned, we also would like to get responses from you. I've got a series of questions I'll be asking during this call, and I will let you know how you can respond to it. Our first question, do you feel you have received adequate information about COVID-19 from your department? Again, do you feel you have received adequate information about COVID-19 from your department? Press 1 for yes, press 2 for no. Again, press 1 for yes, press 2 for no. We will have the question open for 3 minutes, then I'll remind you that you have just a few more seconds, and then we will close that question out. Let's go to our first question from callers today. This question says, why were we told this morning that our schedules would be 3 days on and 3 days off, but this evening it was 3 days on and 2 days off? Stand by as we prepare to answer that question.
Yes, this is Walt Gibbons. So to answer that question, this is a fast-moving train. We've been looking at all options, trying to figure out the best way to keep you as our employees safe, while also maintaining the jobs we need to do. We've looked at a lot of options. The information you received about the days on, 3 days on, 3 days off, 3 days on, 2 days off by shop. That was one of our original takes. We have gone back and we've implemented a different plan that does not include a time on, time off schedule as stated in that question. So you'll be provided further information, and when you show up to your shift, tomorrow morning about that.
If I can ask you again, we pushed the button to open the question that I asked you a moment ago. So if you voted, please vote on this again. The question: do you feel you have received adequate information about COVID-19 from your department? Press yes. Press 1 for yes. Press 2 for no. Again, do you feel you have received adequate information about COVID-19 from your department? Press 1 for yes. Press 2 for no. We will close that out in about a minute. So let's move on to our next question. Will we be having rotating shifts with supervisors? Stand by for one moment. Mr. Gibbons.
Yes, sir. The answer to that question is no. Our supervisors are vital for leading our teams for this and leading our teams through this and every other day of work we do.
Mr. Gibbons, you discussed this a little bit earlier, but this is a question concerning this I want to raise. This is from a grass cutting crew on the east end. A van is being brought out to transport workers to their sites. We are still too close together. What can be done to assist workers to ensure safety of each employee, not just the shift supervisors?
As stated earlier, a new protocol will be implemented as it relates to the spacing in all vehicles used for our Department of Public Works employee going forward.
Thank you, Mayor. Just a reminder on our current question that we're asking you: do you feel you have received adequate information about COVID-19 from your department? Press 1 for yes, press 2 for no. We will close that out in about 15 seconds if you've not already answered it. Let's go to our questions once again. The next question, is grass and concrete more important than our health?
So, that laugh is because that question, I think you know the answer to that. Your health is important. Your job has been deemed critical and essential.
Okay, our next question. If public works is essential, why do we have to use PTO? If infected while on the clock, is this covered under workers' compensation?
This is Jill Isaac, the Director of Human Resources. If you contract COVID-19 while on the job, that will be covered by workers' compensation.
Stand by as we load some more questions, just one moment. Okay, stand by as we load this next question, just a moment. So bear with me just one moment. This question is about an employee who had surgery 3 weeks ago and was released back to work on light duty after doing physical therapy. Employee feels they are more at risk. Should they currently be at work?
This is Jill Isaac again. If an employee feels they're at risk because of a health condition, if the employee provides medical documentation indicating that they are at risk and their doctor recommends that they do not work during this period of time, they will be allowed to take time off.
Thank you, Jill. Our next question: why are the limb loaders remaining out in the field all day when we are not needed in the field all day?
Say that one more time.
Why are the limb loaders required in the field all day when they are not needed in the field all day?
Because you're part of task. That means I stand corrected. You're not part of task. Task employees are set for a certain time, meaning when their task is over, it's complete. But as part of the limb loader crew, you're not a part of that. And so you have to stay on the job as long as your time is required based on your assignments from your immediate supervisors and the department.
So our next question, when the military is deployed during a crisis and we are defined under the Department of Homeland Security to be essential, why wouldn't we be paid?
Not sure if that was the end of the question, not be paid what, but you are being paid.
Okay, let me turn to our next question that we have for the listeners on this call. Stand by for one moment. Do the COVID-19 protocols that have been put into place make you feel safer? Again, the question, do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer, press 2 for somewhat safer, and press 3 for not much safer. You have about 3 minutes to answer that question, and then we will remind you before we close it out. Thank you very much for responding to that one. Let's move on to our next question. Why can we not receive overtime pay like Jefferson County?
I'm unaware of Jefferson County receiving overtime pay. I will tell you this, if you work overtime hours, you will receive overtime pay.
Okay, this question from Urban Forestry. They already have an emergency response team working. Could we only go on emergency response calls until the virus is over, only running that one emergency crew?
This is Walt. I can answer that question for you. So yes, we have urban forestry teams provide a valuable service. When you see your plan tomorrow, we've looked at the critical capability you all have, and we will be utilizing you for operations in other areas too, to assist in that, and also covering emergencies only while on the clock on your regular shift in urban forestry.
Okay, a reminder once again on the question that we have asked you. I'm going to read it one more time with the options to respond, and then we will close it out about 15 to 30 seconds afterwards. The question, do the COVID-19 protocols that have been put in place make you feel safer? Press 1 for much safer, press 2 for somewhat safer, press 3 for not much safer. You have about 15 seconds to respond to that call. Our next question, those employees that don't cut grass or pick up trash, how are they deemed essential?
All right, ladies and gentlemen on this phone who can hear the sound of my voice, this is Mayor Randall Woodfin. I want to make this very clear to all of you. If you are an employee that works for a city government, a local government, that works for a state government, that works for a federal government, by definition, any person that is employed for a local, municipal, city government is deemed essential. It is a slippery slope to get bogged down based on title or description of job or which department or division you're in. All of us are essential. There's an expectation as a resident, even many of you all are residents in the city limits of Birmingham. If you expect, even in the crisis, to take your trash out, and you have an expectation that it's supposed to be picked up. You also have an expectation that if a loved one gets sick at home or there is a disturbance that's required, you expect 911, if you called it, that someone is going to be on the other end of the phone. You have an expectation that the police is supposed to show up. Each of you also have an expectation that a paramedic or a fire truck is supposed to show up if there's a health issue or a fire. You all have an expectation that if you get in your car and travel from point A to B, that as it relates to right-of-ways or any other thing dealing with moving from point A to B, that potholes don't destroy your vehicle because you have to get to the next point, that right-of-ways and other things have to be cut so your line of sight is clear. And I can go on and on for every type of example. Every single person on this phone is essential.
Our next question. We had an employee report that he felt bad. A supervisor came to pick him up for him to go home, and he hasn't returned. What protocol do we follow to make sure that we're safe in case he tested positive? No one has told us anything.
This is Jill Isaac. First, so everyone understands, by law, we can't disclose what was wrong with that employee. That's his personal information. But I can tell you that if you work with someone and they test positive, you will be notified that a coworker tested positive.
Thank you, Ms. Isaac. A reminder on our current question that we have asked, do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for yes. Press 1 for much safer. Press 2 for somewhat safer. Press 3 for not much safer. We will close this call in 15 seconds.
Everybody hold on for me 1 second, please.
Okay, our next question. Do you plan on testing any public works employees, and what is the protocol for us being tested?
There is no global plan to test all of our employees. If an employee is exhibiting symptoms, they will go to their own physician. If the physician determines it's appropriate for them to be tested, they will be tested. If it's determined ultimately that that was an exposure as a result of work, then they would turn that information into workers' compensation, and that claim would be processed for reimbursement.
Thank you, Ms. Isaac. Our next question, similar to one we asked earlier, are all crews going to be moved to a 2 or 3 day rotation?
Again, this is Walt. The answer to that question is no, and that gets back to our plan that we put in place. We're looking at all options. That's something that we considered. Tomorrow we'll go back to how you're doing your regular shifts.
All right, thank you. Let's turn to our next question that we have for those on this phone call. Our question, have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. Again, the question, have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. You have about 3 minutes to respond to this question. Our next question from callers, how do we follow the new protocol if we do not have enough truck drivers?
Yes, the answer to that question, this is Walt. We are, in DPW, we are a public works team. We have a multitude of individual work centers within our team performing functions. We will utilize all of you as our most important assets to carry out our functions. That means some of you may not be working in the areas that you're working at today. You may be assisting other locations. Truck drivers and vehicles are going to be a big deal for us. We will address that. And other departments, we're also looking out across the city of Birmingham as a whole. Other departments we're looking at other individuals and personnel as well as vehicles from other departments to assist us in our critical operations.
So our next question, have you considered earlier start times for refuse and trash and brush crews to avoid contact with residents?
We have not, but that's something we can look into.
We are loading up our next question. Just stand by for a moment. Okay, this question goes to the 6 feet distancing again. I think you've touched on this. I want to bring this up again. When will this be a big concern to everyone? Doctors have asked that we be 6 feet apart. What will it take for us to be safer? What is to be done for us to reduce this exposure?
I'm hoping that whoever just asked this probably wasn't on the call when we've been shared this twice, but I think we'll keep sharing it to make sure everyone understands it. Paul Gibbons and his leadership team are implementing new protocols around distancing in our vehicles for movement from point A to B as related to your work assignments. There are exceptions. Doctors who are working on a patient in a hospital can't be 6 feet apart. Everyone in these trucks can't be fully 6 feet apart, but our new model we'll roll out will create more additional space to make sure that there is less physical contact between you and your coworker to the left or your coworker to the right of you. We're doing everything we can to make sure you all are safe, that there is more additional distance between you, and that we are practicing as much social distance as possible. We have been told, based on assignments, 6 feet won't be successful 100% of the time for all of you all, but the new protocol, everyone will feel some form of relief because there will be more distance for all the employees that are on this phone call.
Thank you, Mayor. Our next question is from someone who works on East End District collecting garbage. A statement and a question: we should get hazardous pay because we don't know whose garbage we're picking up or what's in it. If not, will routes be shut down eventually?
Well, let me say it plain as I can be. This question was asked to me last week. What do you do about, I think the question was, what do you do about contaminated trash? All trash is contaminated. Trash was contaminated before the coronavirus. Trash will be contaminated after the coronavirus passes. Trash has always been contaminated. Trash will always be contaminated. We need to make sure our employees follow protocol on how they engage trash, which is they shouldn't be engaging it with their hands. Before the coronavirus, during the coronavirus, and after the coronavirus.
Thank you, Mayor. The current question that we have open for everybody to respond to concerns testing. Have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. We have another 30 seconds before we close that call out, or that question out. Our next question is from a grass cutter. I was wondering if the schedule will change in any way.
You know, that is something we're actually looking into. We are always trying to find more efficient, creative ways to cut grass. If you have any thoughts, I really, really want to encourage you to shoot them up to your immediate supervisor, shoot them up to me, just shoot them up to Kevin Moore. If you've got some cool ideas or more creative ways on how we can be more efficient, always share them. We're definitely open to listening to some ideas you all have.
Stand by as we load our next question, just a moment. This is a question that's been asked earlier, but this may be a new person joining us as well. When is overtime going to kick in?
Overtime is going to kick in when you have completed your work shift and you begin working overtime.
Okay, our next question now. Just one moment as we look to load our next question. I'm not sure, this is not it's dealing with protocol at the end of the shift, but it looks like it may not be a complete question. I'll ask you, so we're going to move on to that next question, just one moment. Okay, our next question: why are garbage collectors required or entitled to work during this time? Why do we not receive hazardous pay? It's very similar to an earlier question.
No city employees are receiving hazardous pay at this time as essential workers. Everyone is still doing their everyone is still doing their same line of work. We as a city, we as employees, must continue to provide basic services for our community and the residents we serve. Even under a state of an emergency, the work we're doing is deemed critical. But I want you all to know it was deemed critical prior to the state of emergency, and I want you all to know it will be deemed critical when we're no longer in a state of an emergency.
Thank you, Mayor. Our next question for our listeners, our folks on the phone listening right now, if it were readily available, would you be tested for COVID-19? Press 1 for yes, press 2 for no. Again, the question, if it were readily available, would you be tested for COVID-19? Press 1 for yes, press 2 for no. The question will be open for the next 3 minutes. Our next question from callers today, is it possible for administrative workers to have laptops to work from home?
This is Jill Medizek. We are in the process of ordering more laptops so that more of our administrative staff will be able to work from home.
But I do want you to hear me, because I don't want you to think that means everyone is going to get a laptop. Because there are as many people as we have, there's not enough money for everyone to have a laptop. And so that will be a judgment call based on the supervisor for that individual employee assessing what type of work they're doing on behalf of the city.
Our next question has to do with workers' compensation. If we have a claim with workman's comp after contracting the virus, do we still have to use personal vacation or sick time?
No.
Thank you, Mayor. Just one moment as we load up the next question. So the next question, this is an individual who says she's coming off of chemotherapy. She wants to know if there are any plans for employees with underlying health issues at this time.
First of all, for that employee who's coming off chemo, I can't imagine going through that experience, but I am hoping and praying that there are healthier days ahead for this employee, and my prayers are with you. With that said, as Ms. Medizek noted earlier, for any employees that have existing underlying health issues, if you feel you are in a position not to be able to work, that has to be determined with proof based on what your doctor is willing to share with your immediate supervisor and the department head that allows HR to be put in a position what to do next.
Thank you, Mayor. Our next question, why is it that people that have COVID-19 not allowed to tell fellow employees?
I'm unaware of any city employees that have COVID-19. So, again, as mayor of the city that's been on the front lines with the health department every day, we receive constant contact. I'm not sure if that's, I'm quite confident that's a rumor, so let me make this very clear. There is no city employee that has tested positive for COVID-19. Again, there is no city employee that has tested positive for COVID-19.
Stand by as we load our next question. We do not have masks. All we have is lotion. How can you say we are safe, we are exposed, and need masks? When is this equipment coming in?
Masks are on order. We just ordered a large shipment. When those masks come in, they will be given out to the department, and it will be filtered down to those immediate supervisors to determine, based on the type of engagement certain employees have, who needs a mask.
So we have been on the line for about 35 minutes now, so we are getting some repeat questions, likely from people who popped in earlier or popped on later. So I do want to, I'm going to ask this question. This comes from West District, from limb loaders. If they complete their routes or tasks, why can't they leave at that time?
Because by definition, you as a full-time employee are not a task employee. Task employees are the only employees who leave based on when their task is complete. Many of you are very hard workers, and you're in a position to complete your assignments prior to the time as an employee you can leave. However, that doesn't give you permission to leave because you're not in the category of as an employee in task.
Okay, let me remind you of the most recent question we asked to you. If it were readily available, would you be tested for COVID-19? To say yes, press 1, press 2 for no. We have 15 seconds and then we will close that question out. Our next employee asked, if an employee were to contract the virus and the virus were to be passed along to a family member, would the city assist with those expenses for the family members?
No, we would not assist with those expenses.
We would highly suggest, though, many of you all have been hearing me make these daily briefings or every other day briefings, and when I talk to the public, I'm also speaking to our employees. I speak to those three things. 1, if you're sick, stay at home. 2, continue to wash your hands and sanitize. Use hand sanitizer. And 3, practice social distancing. This is also applicable to those in your home. If you're feeling sick based on what the health department has deemed symptoms, they're not only recommending you stay at home, they're also recommending, even within your household, isolate yourself from other family members.
Thank you, Mayor. We have one more question for you that we would like to ask. Have you come into contact with anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. Once again, have you come into contact with anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. You will have a couple of minutes to answer that question. Okay, we're loading our next question. Stand by. Will skilled workers or skilled laborers with CDLs be drivers now?
Say that one more time.
Will skilled laborers with CDLs be drivers now?
They can be. I would suggest you talk to your immediate supervisor or email some of your department heads and deputy department heads on what that process is.
This is a question that was asked earlier. We will touch on this one again. What are you doing to ensure truck drivers are safe with crews?
Okay. When you all come in tomorrow, each of you all will be getting information that's filtered down from the department head all the way down to your immediate supervisors on the new seating and spacing arrangement in city public works vehicles that allows us to create more distance between employees, those who are part of our crew to the left and right of you.
Okay, our next question, can we, and this is similar to questions asked earlier, but can we adjust shifts to accommodate the pandemic to avoid the spread of illness?
At this current time, we won't be adjusting the shifts. That's something we're taking a daily look at. I do want to remind the employees on this phone, this is very fluid, and so we're not rigid. We're asking that you all, ebb and flow with us too. If circumstances deem that we need to, we would not only be more than willing to, but we would adapt and adopt very soon. But at this time, the answer to that is no.
This is a question for Ms. Medizik. What if you have a condition, a health condition, and you do not want to share this with your immediate supervisor? Can you go straight to HR with a doctor's note?
Yes, you may come straight to HR with that information, and we will relay any restrictions or any approved time off to your department without disclosing any underlying medical condition.
Thank you, Ms. Medizik. This next question is a repeat of an earlier question, a couple of earlier questions, so we'll bring it up for those who may be just joining. Because our jobs are considered essential, why aren't we being paid hazardous pay? The state has already issued budgets to address emergency costs.
all City of Birmingham employees are deemed essential during this state of an emergency, but that does not automatically click in any form of hazardous pay. Everyone is still working their routine shift, doing their routine work, so they're getting their routine pay.
Thank you, Mayor. Our next question, when we clock in, we are all in the same environment. Why are we not following the guidelines of only 10 people per gathering space?
There are exceptions for workspaces. Your place of employment is an exception.
Stand by as we try to log in the next question. One, and this is a question, but also I think a suggestion. Why won't we rotate 2 weeks on, 2 weeks off?
That is a great thought. Tell you what I'll do. I'll sit and speak with Walt Givens and Kevin Moore about that option. Can't guarantee anything, but that's something we can definitely look into.
So the next question, very similar, but I think it's looking to the future. Will workers considered essential in the future receive additional money?
The only additional money at this time you can receive is overtime pay for working overtime hours after your schedule has exhausted itself, and if you're still working.
Okay, our next, let me wrap up the question we asked to you. One more time, if you haven't responded, you have a chance to respond. Have you come into contact with anyone who you believe has had COVID-19 symptoms? Press yes, press 1 for yes, press 2 for no. Again, have you come into contact with anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. You have another 15 seconds to respond to that, and then we will close out that question. And with that, we are running low on questions at this time. The last question, citizens are being asked to stay home, but why aren't city employees being treated the same? Why do we have to work instead of be home and safe?
There are a couple of reasons. Many of you all live in the city limits of Birmingham. If you stayed at home, then no one would pick up your trash. If you stayed at home, then no one would be on the other end of that phone call if you call 911. If you stayed at home, then no one would be in a position to bring a fire truck to your place of business or your home if something caught on fire. If someone needed assistance and they couldn't drive and needed to get to the actual hospital, then a paramedic would not be able to come to them if you stayed at home. We are public servants. We don't have the luxury to stay at home. And when there is a crisis, it is incumbent upon us to step up to the plate and lead. I know many of us are scared. I know many of us are worried. I know many of us have families. I know many of us have concerns. But at the same time, 211,000 people are dependent on the people on this phone to continue to provide basic services for them. So even in this state of crisis, there is some sense of normalcy. You all provide some sense of normalcy for the residents of this city. I don't care what anybody says, you all are heroes in my opinion, because you get out here and you work. You work hard, you bust your butts, you take it. You deliver for the city, you deliver for these residents. And as your mayor, I'm very proud of you. Walt is proud of you. Ralph is proud of you. The whole team is proud of you. I know this is a tough time. I know we are in a state of an emergency. But I'm telling you all, we're going to get through this. The best way we get through this is sticking together, remembering we're a team, remembering that the residents are depending on us, and we have to come to work to deliver services for our residents. I want to thank each of you all so much for being on this call. We're committed to you. We'll do this again. I think this is the first time something like this has ever been done. I think this is the first time y'all have actually asked questions. Maybe we should do this more so than meeting in person, because people actually talk via questions. So just know we're with you, we support you, we thank you, and we appreciate you, and have a good day.
Thank you all for being with us on this call today. A reminder for you, if you still have questions that have not been brought up, you can stay on the line after we disconnect, after this phone call ends, and you can press 7, stay on the line, and you can leave your message. Also, if your friends, if you want to re-listen to this, or if you have friends or coworkers who would like to hear it, you can go to birminghamal.gov/coronavirus. We will be posting the audio from this call later today. birminghamal.gov/coronavirus. You will see this listed. All of the Tele-Town halls that we were doing are listed based on the most recent calls. Thank you for your service to the city of Birmingham, and thank you for being with us today.